Yep.
Oh, there we go. All right. So, good afternoon, everyone. Thank you for participating in today's our second info session on the COVID vaccine. We are doing going over some frequently asked questions today, reviewing our survey results, and talking about a few of the areas that were of concern from the survey results. And at the end, we'll review the website page again and the links that we provide. And then if anybody has any specific questions and answers, we can go over that as well. Just a reminder, we are sending out a Vax Matters newsletter. So check that out. We are still continuing to do the raffle. So we will pull a winner once a week for staff that are receiving the vaccine. They need to send in their vaccine card to be entered into the weekly raffle by before Wednesday at noon of every week. Okay, so let me just review some of the survey results, and I'm going to pop into the chat a link for the survey. If you haven't filled it out already, please make sure to do that. We'd like to continue to get feedback from staff. So far, let me just share this. And there's also a link in the Vax Matters newsletter. Let me just throw this into the chat. Okay, so as of today, we have 102 responses to the survey. And out of the 102 responses, do you think I should share it or just review? Let me see. I'll just discuss it. Okay. So out of the 102 responses, we have 35% have had the vaccine or are scheduled to get the vaccine as of today. And so obviously we're really trying to encourage and promote people to get the vaccine. So we'd like to see that number go up. And but 63% are interested in getting the vaccine. And that number does continue as more people complete this. 11% are unsure about getting the vaccine, so we'd like to talk about that. And 26% are not interested in getting the vaccine right now. Okay. 60% would like to get the vaccine as soon as possible. And 40% would like to wait and see what happens. And this is pretty consistent with what we're seeing and hearing in the general population. And so some of the major concerns, which is what we're going to focus a little bit of time today talking about, are some of the reasons why staff are unsure is that they're worried about side effects. And also worried that they might get COVID from taking the vaccine. So we'd like to just jump right into a discussion on that. Okay. Radina, would you like to talk a little bit more about side effects?
Sure. I actually just recently took the vaccine, the first dose. In general, the only side effect that I've seen is a little bit of fatigue and pain in the arm. If you've ever taken the flu vaccine before, you know, there's some soreness to your arm that sometimes, you know, you feel you can ice it or whatever. This one is a little bit stronger as far as the discomfort, but nothing major. Some other common side effects are chills, fevers, as per the CDC. What I took was the Moderna vaccine. They are though indicating that a lot of those side effects when it comes to like fevers and chills, you can expect maybe after the second dose. But as it pertains to the first dose, it could appear slight headaches, that kind of stuff. I did feel a little bit of a slight headache when I took it, but that's about it. And the CDC has documented that. Other than that, nothing major to report.
Okay, sorry, Donna, did you want to talk a little bit more? Mm-hmm.
Yeah. Just to build on what Radina said, I just want to first say that it's normal to get some type of reaction when you get a vaccine. So nothing's really to be afraid of. If you do get a reaction, as Radina noted, although they list, 5 or 6 different side effects that you can get, majority of people get either, the top 2 that they mentioned that the majority of people do get, if they do get anything at all, is pain, at the spot where you did get the injection. You may get a little redness, you may get a little pain. Other than that, people have told me, and again, the second leading side effect is just a little fatigue. People tend to feel a little bit tired that day when you get home from getting the injection. But again, there are other side effects, but majority of people do not get it. On a personal note, I did also get the vaccine. I felt it was very important to get it. I do have a family. I have elderly aunts and mother-in-law that I, would like to see and haven't been able to see, and many family members. I just felt by getting this and hearing at this point there are so many people who have gotten it already, I really did feel comfortable getting it. So as soon as I was able to schedule myself, I went and did just that. Personal reactions that I had or a side effect that day, I would say I had a little bit of pain in my arm. Nothing that was I even had to take anything for. I didn't get any redness at all. I didn't even get the fatigue. So for me personally, it was just a little uncomfortable at the injection site. And at this point, I've been the person responsible for scheduling the staff in New Jersey to get them. And I'm happy to report that at this point, we have at least 50 of our staff who have already gotten it. And I'm on the phone. I was on the phone all day, well, this morning, scheduling at least another 20. So, again, I know it's a personal choice, but I do encourage everyone to get it. And I'm happy to report the number of my folks in New Jersey, who have been getting it. There are obstacles, obviously, of scheduling it, especially in New York. And I don't see that getting any easier. So if you are planning on getting it, I suggest you really get on that list now. Make those calls. Things change every single day, but it's so, again, as I encourage everyone to get it, I also encourage you to start making those calls and scheduling it, as soon as possible. And that's, again, normal to get some type of reaction. And even all the staff that I've already had in New Jersey who have taken the vaccine, I haven't gotten of any reports that anyone really had very bad side effects. So that's about it.
Okay, the second issue, so that was the number one, and again, in the survey that we did, that was the number one concern that people had were the possible side effects, which we reviewed. And the second one was, can the COVID vaccine actually give you COVID? And the answer to that question is no. The COVID vaccines currently being developed in the United States do not use the live virus that causes COVID-19. And keep in mind that it does take a few weeks for your bodies to build immunity after getting the vaccine. So as a result, it is possible that you could become infected with the virus that causes COVID-19 just before or after being vaccinated. And as Donna and Radina mentioned with the side effects, the side effects are your body's response to receiving the vaccine. It's not that you are getting COVID-19. And the information we're providing is found directly from the CDC, which again, we do encourage people to get reliable information when they're gathering information to make this important decision. Okay, Joe?
I'm just going to pull up some questions that you can answer on your phones. And if you could, you have to answer each of the questions. So we're just interested in seeing what education people might want, where people are at with wanting to get the vaccine. So if you could just take a few, it won't take you long just to answer some of these questions. Or not. Can you see the poll? Can you answer the question? Can
It's
you
n- it's
see
Right
how?
on, it's
It's
right
not
on the
letting us
screen.
click it. Do you
I'm
see?
seeing, oh,
Oh. Why did
We
it
can
work?
view
Yes.
it. That's weird. We could view it.
Oh, there you go.
Oh, there you go. Okay.
It is anonymous. I should have said that in the beginning. We don't know who's answering the question, so it's okay.
And did you want to go over that that good visual that you shared yesterday?
Yeah, I just don't know if I can pull it while this is still going. So let's just give people a couple more minutes. 50% have answered right now, so I'll shut it down in a few more seconds. Okay. Let me see, maybe. Okay, should I end it? I mean, we got 7 out of 10, that's good. We've got everybody then. Can you see the results, Linda?
Mm-hmm.
Okay. All right, so yes, no. So a couple of people still not interested, 5 are interested. Soon as possible, wait and see how it works. And that's a big thing that people want to see how it is working. Worried about side effects is big. Worried you can get COVID. Okay, great. Thank you for
Yeah, and
doing
just to reiterate, you cannot get COVID from the vaccine. So I just want to reiterate that there's no evidence. It is not the a live strain of the vaccine. So there's no way that you can get it. And as far as the side effects, the vast majority have been very, very minor side effects. So just to reiterate that information.
Can you see that? Can you see my screen? Okay, so Linda touched on some of this information. And so some of the myths about the COVID vaccine is it was rushed and it isn't safe. But we're hearing more and more that it wasn't rushed. They had already been working on a COVID vaccine, not COVID-19, but they had been working on a vaccine for this virus. And so researchers took no safety shortcuts. There was large studies showing the vaccine is safe. There was another info session for people we support last week where somebody was part of the trial. So he had the vaccine a year ago and he's still doing okay. So, it is safe to get it and it was not as rushed as people do think. It changes your DNA. Linda touched on this. It does not, it's impossible for the vaccine to change your DNA. It can give you COVID-19, as Linda mentioned. It doesn't contain a live strain, so it cannot give you COVID-19. It contains egg protein. It doesn't contain egg proteins and can be given to people with egg allergies. I think that really comes from the flu vaccine. People can't get the flu vaccine if they have egg allergies, I believe. I know that with some of that as well, someone talked about if you have shellfish allergies. So if you have shellfish allergies, you can still get the vaccine. They will just monitor you for longer than 15 minutes. Once you get the vaccine, They usually keep you around for about 15 minutes just to check you don't have a reaction. If you have shellfish allergies, they will keep you just a bit longer to monitor you. It causes severe side effects. Both Donna, Radina, and Linda have touched on the side effects. It's mild side effects. Some people are saying that, that they may get some flu-like symptoms, but so far I haven't really heard of anybody having major side effects, as Donna and Radina said, just some soreness in the site of the injection. It makes women infertile. There's no evidence that the vaccine causes infertility. That hasn't come out, and I have heard on a few webinars doctors say that is not valid right now.
Okay. Next we wanted to just have Radina share a personal testimony again. In our focus right now, just to answer before you start, Radina, our focus right now is the individuals, our direct support professional workforce is in the eligible group. So this is what we're really focusing this initiative on. In addition, individuals with disabilities who live in our residential programs are part of this phasing group. Individuals with intellectual and developmental disabilities, again, in New York State, who are living with family and their family members are not specifically part of this phase-in group, but I would encourage people to continue to check every day and see if maybe based on age or some other factor, they might be part of a group. And I'll go through that. But we wanted to really talk specifically to staff, and we know that there's a lot of concerns out there. So Radina was going to share her personal story and journey, and as a way again to just encourage people to consider getting the vaccine.
Hi, everyone. So as we've mentioned, it's obviously such a personal choice to take the vaccine. Just by nature, in the position that I have at the agency, I've been looking at and I follow everything that the CDC puts out, that each individual state's Department of Health puts out, all the information pertaining to the virus itself, how it's spreading, projections on how much of the population it's going to affect, which areas and which groups it affects the most. I was one of those people that was very hesitant to get the vaccine when it first came out. I have my parents asking me, what do you think? Family members, everyone, are we getting the vaccine right away? I was one of those people that was like, let's wait and see. Based on the information that I've been seeing, especially when it comes to the variants from South Africa, from the UK, and how it's affecting the numbers and how it could affect the numbers, it made me start considering the possibility of just, getting more educated on the actual vaccines, the side effects, and just taking a personal look at how would that affect, my family. For example, we're a very close family. I didn't spend Thanksgiving, I didn't spend Christmas, and I didn't spend New Year's with my parents. My dad was extremely upset. He loves his grandkids. He likes to have us all together. We had to, as we all had to experience, we had to do Zoom for those special moments. My mom's birthday was in December. I didn't feel comfortable to be there. I went to say hi, but kept the mask on. I didn't want to risk, if God forbid somebody in my household had the virus and was asymptomatic, I couldn't live with myself if God forbid we spread it to any of my family members, my parents in particular. On the same, as far as my particular household, I've had my own struggles in the past with just pulmonary issues. I've had pneumonia a few times in the past. I am one of those people that has to be very, very careful because I have allergy-induced asthma. And, I look at my kids and I'm looking at the data and how the variant is becoming a little bit more prominent. It's supposed to be, the UK variant should be the dominant strain come March. in the United States based on, CDC projections and the information that I've gathered, and, just hearing Dr. Fauci, which I love, speak, and the risk of me potentially getting the virus and possible complications, especially since I've battled with respiratory issues in the past. I couldn't do that to my children. The thought of seeing, God forbid, becoming critical because of COVID or being exposed to COVID and having my children worry if I had it, really made me take a look at the fact that, the side effects so far that I'm seeing and it's being reported as part of the vaccines, you know, it made me feel like it was my obligation to give it a chance and see, and protect myself, and in turn protecting my family. I couldn't imagine. You hear all these stories of parents, loved ones, friends, being critically ill, being in hospitals, by themselves, family not being able to be there. And I, like a lot of people in my community, in the Latinx community, we care for our parents. They depend on us to a certain degree. I can't afford to be that far away from them. And I can't afford to not be around for my children. The benefits of some added protection, possible, long-term immunity, even if it's short-term, is enough for me to want to do everything I can to be around for my children. At the rate that things are going, even in the small town that I'm at, it just feels, their chances of being exposed to someone with COVID is greatly increasing as the numbers are increasing. And the variants are so, they're highly contagious compared to the regular variant strain of the COVID virus, that I just educated myself as much as I could on it. And we made a collective decision, my husband included, that we should do everything we can to get the vaccine. And again, we understand it's a personal choice. I was very scared, even up until I went to get the vaccine. I was nervous. But like I said, aside from my arm hurting because I'm a big baby, so it probably hurts more just because I'm a big baby, and just being fatigued, so far so good. And I'm hoping, with the grace of God, I have to bring them up, that, this will it's giving me some peace of mind at this point. And I think it means a lot. My kids were actually very happy that I got it. And it was interesting to hear even my 8-year-old say, at least now, mommy, if we do come across someone that's positive, you'll be okay. So, I could tell that it was even weighing on them, an 8-year-old, the responsibility of them having to be safe because they were scared that I would get sick. So that made it so much more important for me to do that for them, do that for my parents, and do that for myself. So that's just my little tidbit. And we hope that through these little, town halls and offering information, we can ease some of your worries and gather more information. Even if we don't answer any questions that pertain to you or what you're worried about, feel free to reach out to us and we'll gather as much information as possible. And that's all I have.
Thank you, Radina. So we, as Radina mentioned, we want to do everything we can. So this is one of the ways to help to keep people safe. And the more people that get the vaccine, the better outcomes there will be. We do need to remind everybody that we have to continue to follow the safe practices that we put in place of wearing face coverings, minimizing your social interactions in group settings, washing hands regularly, monitoring signs and symptoms. And there has been some suggestions about doubling up on masks with this new strain as being another suggested method when you're not able to maintain social distance. So we want to just continue to remind people to take those precautions. I wanted to share a few things with you. So let me just bring up my screen.
And if anybody has any questions, feel free to unmute yourself or put it into the chat. You can do that.
Okay, can you see, you can see my screen?
Yeah.
Okay, great. Okay, so I did put in the chat, we did dedicate on our website a page to the vaccine information. And these are all legitimate resources, valid information. So if you scroll down, you could see there's New York City, Nassau County, New York State, OPWDD information, which I find very helpful, New Jersey, general vaccine information. So we have, if you have specific questions, obviously none of us on the call are experts in this specific field, but the information that the CDC puts out on the vaccines is here, the FDA, a fact sheet from Pfizer and Moderna, a very a good presentation is here. So you can, we'll continue to add to this as we gather resources. Unfortunately, we were off to a good start with promoting and getting staff to sign up. And then, as you have been probably following in the news, right now we've hit a roadblock where the availability of vaccines is not where we would hope it would be. But what we are encouraging staff to do, so in New York State, CFS does not have right now at this moment a direct contact to schedule staff to get vaccinated. In New Jersey, as Donna Messina mentioned, they're handling it a bit differently. So for staff that are seeking the vaccine, they can work directly, with their supervisors and with Donna to schedule those appointments, as long as they are available. In New York, we are encouraging staff to come here, click on the link. For example, for New York City, if you click on this link, it's going to bring you to the nyc.gov COVID vaccine page. This is also, I find, very chock full of information. And if you click on the eligible groups, is also in a bunch of different languages. If you click on the eligible groups, you'll see, if we scroll down, this is the current phase that we're in now, healthcare workers. For staff, again, this is in New York, staff that are working in the community. They would fit into the category of all outpatient ambulatory frontline high-risk healthcare workers who provide direct in-person patient care. For staff who work in our residential settings, they would fit into the residential and staff in group living facilities. And you could see OPWDD is mentioned here. As I mentioned before, it does not include the individuals with intellectual and developmental disabilities who live in the community or at home with their families at this point in time. And it doesn't include family members. But if you continue to scroll down, you can see other groups have been added as of January 11th. So people over the age of 65. So some of our family members might be eligible, some of the individuals we support. And there's some other types of people working in the school system. So just continue to check here for the eligible groups. And then if you want to find the vaccine site closest to you, again, check this regularly. You would come in here and you could plug in, your information. So if I just plug in a zip code here, it's going to, show you all of the different, both the Department of Health and the private clinics. This is a public-private partnership, and you can schedule appointments right here. However, unless there's a miracle, if I click schedule appointment, because of the lack of vaccines, you're going to see this. There are currently no first doses. Again, I'm just specifically talking right now about New York. You can subscribe, so you can put your email information here to get email notifications when new appointments are added. So at the very least, I would encourage people to do that. So, and again, I come in here and I check regularly, and anytime I speak to staff, because tomorrow we could get more doses and appointments will be open up. So information is rapidly changing. So continue to just, check over here. So yeah, so even if there's a priority, if there's no doses, they're not able to get the vaccine. So, but once the doses are available, you can, you're still part of that priority group. Okay. Donna, did you want to say anything else about the process in New Jersey that might be helpful?
I'm sorry, I was, no, I mean, it's only that it's such a different process and I'm sorry that it's, not that way in New York. We did have the federal government agreed to enlist several Walmarts in New Jersey across the state, 12 as a matter of fact, in all different counties. And by doing that, they put all those Walmarts in touch with different agencies in the different counties in New Jersey. So last Monday, actually on the holiday, I didn't expect it to happen so soon, but I got this call from one Walmart explaining who they were and asking me if I wanted to make appointments. And by the end of Monday, I had heard from 3 different Walmarts. And then the next day on Tuesday, the 4th Walmart called me. So that started the whole process in New Jersey. We deal with these 4 different Walmarts in different parts of the state. And what they do is they set aside certain days, certain hours, and a certain amount of vaccines to be given out. And that's how I, was very busy last week, actually, when the whole process started, to get as many of our individuals and staff into these sites to actually get the vaccination. We were very successful in the first week. As I said before, the numbers are climbing, but the first week, I think we had a total of like, I don't know, maybe 50, 58, 60 people, a combination of individuals and staff who got vaccinated. And we have a bunch more this week. And as I said earlier, I've been scheduling appointments for next week. So it is much easier here in New Jersey, and I get that, and I'm jumping on that opportunity. But again, I just want to say that I'm just very happy with the responses and the emails that I am receiving from my staff requesting for me to make appointments for them. So I just hope it gets a little bit easier in New York, so you can begin the process. Because I don't know when, I think I just got a Citizen. I don't know if any of you have that Citizen app on your phone, but it does give you updates about the COVID vaccines and the availability, on a daily basis, or if new sites have been opened. So again, as Linda said, if you're going to do it, which I think we all encourage that you do, you just have to start making those phone calls in New York, because the system and the process is a little bit different.
Yeah, I mean, the federal government is, determining how much the states receive. And we've gotten in New York 250,000 vaccines. There's over 7 million people who are eligible just in this current phase. So the essential workers, many of which are not able to get it if they didn't get it early on. So the limited supply is really having an impact. And similar to in New Jersey, in New York, you are able to go, there are pharmacies, there's hospitals, there's a local state department. So it is a public-private partnership. But if there's no doses available, that's where we're at in this moment today. Which could change. And if you're following the news, there's been a lot of discussion with the federal government to try to expand the resources to the states. So we want to make sure that, in the very least, if you're somebody who is worried about, or heard a rumor, a myth that we went over today, that if that we can help provide you with the accurate information, so that if an appointment becomes available tomorrow, that you can say, okay, I'm ready. And because as people wait, or if they're really, the situation might become more and more difficult. So as they expand the groups, which they haven't yet, but as they expand it to the general population towards the summer months, it's going to probably get a little bit more challenging to get an appointment. So let's take advantage if you fit into one of these groups now. And again, CFS is trying to work on partnerships in New York, but again, we need that availability. So if the situation changes and we are able to partner with an entity to schedule people to get the vaccine, we would definitely do that. We're wanting to do that, but it's not something that's available at this moment. So
Linda, if I may, for New Jersey, I just put in the chat a URL. There, you can pre-register for the vaccine. What it really does is, and I had done it because I live in Jersey. You put in your information, and it'll actually let you know when your group is up. So let's say if maybe you're not eligible at this time because they're in, phase 1A, but you're eligible when it comes to 1B, it'll send you an email and tell you can now go ahead, you're eligible for the vaccine. There's also through that link that I sent, you can see what sites are offering the vaccine in New Jersey, and it gives you a list, and some of them have links or phone numbers, depending on the county. In some of the links and some of the sites that are giving the vaccine, you can register with them and say, I'm eligible, I'm under this group, and they'll let you know when something opens up if they don't have any appointments available. But that URL is really good. You could just go and type in Google New Jersey DOH, Department of Health, COVID, and it'll take you to their COVID hub, and you can get more information about the vaccine on there as well.
And Charles had put in the chat that his wife is a healthcare worker, tried to register. She gets no priority. In fact, was told that there's no priority and everyone gets treated the same. I mean, that isn't correct information right now, but I can understand. I think that there is some confusion about who can get it. And I think, unfortunately, even some of the workers who are taking appointments, making appointments, are giving different information. So it might be that if she called again and spoke to somebody else, it would be a different answer. That's what I am hearing as well, Charles. Thank you for sharing.
Yeah, and I think when you go in to actually schedule the appointment in New York through the Department of Health, either the state or the city pages, it's going to ask very specific question. I mean, one of the very first questions is, are you a healthcare worker providing direct patient contact? Are you over 65? So there's very specific categories. They have not expanded it to the general population yet. But as mentioned, there's 7 million people that fit into a priority category, and we only received 255,000 vaccines in New York State. So it's very clear that we don't have the amount that we need at the moment, but that could change. Joe, do you want to talk about next week's session? I'm trying. I can't remember the date and time, but do we want to just?
February 3rd at 2 p.m. So it's going to be a Wednesday instead of a Thursday. We were trying to do them every Thursday at 1, but the person that we have presenting next week is, she's a member of our board. She is a doctor. And so she's going to talk about the COVID vaccine and the safety of it and how it came about. And so she's going to answer some questions again next week. That's February 3rd at 2 p.m.
She's actually, if I may add, she's, as Joe mentioned, she's a board member, Helen Yeardley, and she works for a pharmaceutical company, and she has some information regarding the clinical trials and how the Pfizer vaccine in particular came about and the numbers of people that were involved in the clinical trial. So it should be very informative.
Right.
Okay, and then just as a reminder, so if you do get the vaccine and you work for us, then take a picture of that the vaccine card and send that into HR Vac Stats. And that goes right to our Human Resources Department, and you'll be entered into a raffle. If you do win and you'd like for us to share your name, we'll put that in our VaxMax newsletter, but that is certainly not required. We also have, just taking vaccines. So if you'd like to share a fun picture of you, please do that. Our goal is to encourage people to get vaccinated. So, we feel like it's great to celebrate those people that are doing that and show others, that their colleagues are also taking part of this important initiative. We're going to try to continue to hold these kind of sessions. We're going to continue to plug the survey. I did put that in the chat, and I think that's all that I have. Anybody else?
No, I also have not had the vaccine yet, but I am hoping to get it soon. One of the reasons I want to get it is my family lives in the UK and I haven't been able to travel, as many of us haven't. And I think that that will be another reason to get the vaccine, because I do believe that some airlines may not let you travel without getting the vaccine. So if we have family in different places and we want to travel, it may be another reason to get it for sure.
I do see in the chat, so if there's specific medical questions, so again, we are not medical experts, as you know. The best person to speak to would be your primary care physician. So if you have specific concerns, talking to your own primary care physician, a trusted health professional who understands the whole, your whole situation, your whole history, would be able to be the person to give you the best advice. So it would, we definitely encourage you to do that. But if you did definitely, if you want to send over questions, we can. The expert we have next week, is working through pharmaceutical rep, but what we can try to see if we can get some answers to your questions. So Mr. Gans, if you'd like to email that to me, and certainly try to help you out with that. All right, so we are recording this session and we're going to put it up on our YouTube. We did have a session last week. Was it last week? Yeah, we did have a session last week with a public health educator who works in one of the New York City hospitals. She did a session in English and in Spanish, and that's also up on our YouTube page. So feel free to take a look just by Googling CFSNY on YouTube, or there's a link on our website. And we'll definitely get back to you. Any other questions, comments? Anything you'd like for us to cover in future meetings? Okay. All right. Well, thank you so much for taking time to be with us. Yes. Have a great rest of your day.
Thank you. Thanks for all you do.
Thank you.
Thank you so much. It was really informative.
Thank you. Have a good one.
Thank you. Bye.
Bye.